international students in Australia have a valid concern regarding whether am I covered if I get infected with COVID-19. So we went and explored the answer for this question for you guys, and we found some interesting information. And we will share that information in this video. Now before we start talking about this question, we would like to tell you, if you are new to this channel, welcome. We make videos for international students who are planning to study in Australia or currently studying in Australia. So if you're new to this channel, I recommend you to subscribe. And if you are our regular visitor, welcome back once again. And before we dive into the video, if you do like the content of the video, make sure to give it a thumbs up, as it not only motivates us, but it also gives a signal to YouTube algorithm that this video is useful for people. And then they show this video to many other people. Now, international students are required to have a health cover before they come to Australia for their studies. Overseas students health cover. And they must have this insurance until they are in Australia on their student visa. And there are 6 main providers of this OSHC insurance. They are AHM, Allianz, Bupa, CBHS, Medibank, and NIB. Now if you are on a student visa in Australia already, you are probably signed up with one of these services. And most of the international students do rely on these insurance companies when they get sick. But this time around, as we know, this virus is infecting many people, and international students have the same concern as well. Now before we answer this question, whether your health provider actually covers you for COVID-19 or not, we have to make you understand few other things to clarify the whole situation. Now let's understand from the point of view that what if you start feeling unwell and you may have a symptoms of COVID-19. Now what are the common symptoms of COVID-19? Usually one of the most common symptoms is high fever, dry cough, you may even have a sore throat, and shortness of breath. Some people also complain about body aches and runny nose as well. Now if you do feel that you have these symptoms, what you should do next? Now first thing first, what you should do is contact the National Coronavirus Health Line. You can call 1-800-020-080. That's the national health line number that's operating 24/7 at the moment. Once you call them, they will guide you whether you should go to your local hospital or you should go and see your GP. Based on their suggestion, if they suggest you to contact GP, make sure you call your GP before going to the clinic. No clinics are currently accepting walk-in patients for COVID-19 in Australia. So you need to call them and tell them about your symptoms. There's also services of telehealth available where you can contact your GP through a FaceTime or through your mobile. Now before calling any GP, make sure they are listed on your overseas student health cover provider's website so that they are approved for your insurances. Now once you call your GP, they will ask obviously a few questions and they will let you know whether you need to be tested or not. There are criteria set by Australian government for the testing. So if you don't fall in that category, you may not get tested for COVID-19. But if you do fall in that category, then you will get tested. Usually blood test or swab test is done for COVID-19. And then once the test is over, you will be notified within a day. Sometime the rapid testing can tell you within an hour or so as well. Now depending upon how critical your condition is, you may get hospitalized. But if not, you may be sent home and ask you to look after yourself at your home itself. And obviously they will check back with you how your health is going even if you are at home. And when you are tested positive, you are supposed to be at home for the 14 days or so and make sure to look after your health. If you does feel that it's getting worse, you need to contact hospital immediately. Now if you think that the situation is life-threatening, always call 000. Now one more important thing to understand is the cost involved in the whole process. So if an unfortunate circumstances you do get infected, these are the costs you need to be mindful of. First one is GP consultations. So if you are consulting with your GP or if you are consulting with the telehealth as well, you need to understand there are costs involved for that. Obviously, if you need to get tested, there are costs involved for the testing. If you need to be transported to the hospital through an ambulance, then the cost of ambulance is there as well. And if you need to be hospitalized, you obviously have hospital expenses, which includes your accommodation and any tests or anything they do in the hospital. And if doctors do recommend you to have some medication, then the cost of the prescriptions is there as well. That's very important to understand this whole process and the cost involved, because to answer the question whether you are covered for COVID-19 or not, it depends upon this process and the cost that we just discussed. Now to answer this question whether you are covered for COVID-19 or not, now in general it seems like most of the insurances are going to cover most of the expenses for the COVID related treatment. But there are exceptions to that. We went and did research on all the websites of these health cover providers. And we found some interesting information, like for example AHM. They are saying that they will cover up to 85% of MBS for your COVID testing. So if you need to get tested, they will cover up to 85% of the MBS. MBS is like an approved government fees. It's known as Medicare Benefit Schedule. So basically you might be out of pocket for 15%. But they do say that they will be covering you for the medical expenses for your hospital and some prescriptions as well. While Bupa is saying that they will cover 100% of your COVID testing related expenses. So it kind of purely depends upon what type of provider you are with. What I want you guys to do after watching this video is to make sure to go on the web page of your health cover provider. We will make sure that we will put all the links for your health cover providers in the description below. Specific pages related to coronavirus. And we want you to check out what's covered and what's not covered in your insurances. Because if we start talking about individual insurances, it can take ages for us to complete this video. Now, one very important question that comes in our mind is, will I be out of pocket for these expenses? In short, yes, there could be a chance that you will be out of pocket for some of these expenses. Because your insurances usually cover you until a certain extent. And if there is any gap between what a hospital or the GP charges you and what's covered by your health cover provider, that's known as a gap fee. And that gap fee has to be usually paid by the patient. So a really simple example, if I go to GP and my GP charges me $70 for the consultation and my health cover provider covers me up to $50 for that, I'm out of pocket for $20, which I will have to pay myself. This is just a general scenario. It may not be specific to your situation, and that is why it's very important. You need to check with your health cover provider what things are covered, what things are not covered, and until which extent they are covered. And it's very important you check on their website and you call them as well. The good news is that if you are in Victoria, Victorian government has made sure that if you do get infected with this virus and you don't have adequate insurances, the Victorian hospitals will waive the cost of treatment for you. So it's a great initiative by Victorian government to make sure that everyone in Victoria gets treatment. And I hope that the other states and territories follow the same process as well, making sure that everyone is covered for this deadly virus. Now the situation is not really great at the moment. And some students may feel a bit of anxiety, nervousness, or some sort of mental health issues. If that is the case, you need to speak to your health cover provider because there are some sessions for psychological help that are available in your insurances. Again, check it with your health cover provider before you book any session for that. But apart from your health cover provider, you can also reach out to some other organizations which provide mental health and counseling services. So organizations like My Compass, Youth Beyond Blue, Lifeline Australia, Kids Helpline, Headspace, and Reach Out. These are some of the organizations that you can reach out to if you need mental health support. As we do recognize that this is a difficult time for many international students. And if you do need a support, reach out to these organizations. But before, you should also contact your health cover provider as well. Now, if you're stuck overseas and you can't come to Australia, you certainly can cancel your policy, or you can also change the dates if you are planning to come in the future. Now, one important thing for you guys to understand is that if you do unfortunately get infected with this virus, it is not going to affect your visa or enrollment. Well, I hope you find some value in this video. Again, if you do find some value, make sure to hit that like button and share it with your friends. And thank you once again for watching. See you in the next one.